Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. Jay Calvert, here today with my fox-eyed co-host, Dr. Millicent Rovelo. Are you ready to talk about the fox-eye procedure?
No. Almost,
I know you're not.
Literally and actually, I can't even. I won't even.
You know, I knew you were going to say that, and I knew that this was coming. But we have to talk about the fox-eye procedure because it is all over social media and the internet.
Okay, fine.
We have to.
I know. So why don't you introduce what is the fox-eye procedure?
So it depends who you ask.
Okay.
But typically, it involves what's called a Canthoplexy.
Okay.
Or a Canthoplasty.
Mm-hmm.
And the canthus is this little part of the corner of the eye where the eyelids come together and meet on the lateral, the out to the side aspect of your orbit, the bones around your eyeball.
There's also a medial canthus.
There is a medial canthus. This has we will not be touching that.
No.
Everyone knows, stay away from the medial canthus. But the lateral canthus is an area of beauty because some people's canthus, their canthi will go down and it makes them look sad. And when it comes up, it looks a little more mysterious, a little sexy, right? So
Foxy.
it's exactly right. So the fox eye is a term that's been ascribed to the Canthopexy. And I do Canthoplasty also. So the difference being one is where you're tacking the canthus up to the bone with the stitch, and a Canthoplasty is actually where you're cutting the corner of the eye and cutting the ligaments,
Making it shorter.
and reconstructing it and putting it up to the corner of the eye. And then typically, I think, based on my understanding, that the fox eye procedure in my world includes a lateral brow lift as well. So you're doing something to the canthus of the eyelid, of the eye, and then also the lateral brow lift. In my world, I tend to do a mid-face lift with it also, because I think if you're going to get the brow up, you should also get up the cheek, and that looks very sexy and very sultry.
Yes. So none of these techniques that you were describing are new or novel or not generally performed together. Like, these were literally the techniques that plastic surgeons have been using for decades to rejuvenate the periorbital area. So I guess my question is, who is either asking or getting this procedure? Because the combination of procedures you just described are what we typically use to address the aging periorbital area. Someone that's seeing some loose skin under the eyes, that's seeing their brows drooping, and they need to be sort of rejuvenated. So we do all of these procedures when we're doing lower blepharoplasties, mid-faces, lateral brows. Is there also a group of young patients that are doing it specifically to change the shape of their eye?
Funny you should ask that rhetorical question, because yes, and that is the key, because this is being done for people in their 20s and early 30s, just not as a rejuvenating procedure. It's not to make them look younger, it's to make them look better. And I've done this on 26-year-olds, 27-year-olds, 32-year-olds, and it's a way that, I think what's really given rise to this is the combination of fillers and Botox. So people do Botox, they get that little lateral brow lift, they do some crow's feet, and they get a little bit of lift at the corner of the eye, and they put some filler in, and it pushes the cheek up, and they're trying to get that fox eye look. Well, the surgical approach is a little more extreme, a little more permanent, a little more, it's just a little better. But I will say this, I have a patient that called me about sort of undoing their fox eye procedure. They were from back east, and they said, this didn't turn out the way that I wanted it to. And when I looked at it, they had like an ectropion, it just was done poorly, So you need to go to somebody who's skilled in the art of Canthopexy or Canthoplasty. Yeah. And I've done a lot of these, and I really like this operation. I think it's cool. I think the fox eye procedure does make people prettier. I think it looks awesome, especially if you get a good lateral brow lift and a mid-face lift with it.
Right. It brightens everything.
Yeah.
And just it opens everything up, even though the term is fox-eyed, but it does. It sort of brightens the area. I guess my question is, how much can you actually change the shape of a round eye to an almond eye with this procedure? Because we all do it when we do our lower blepharoplasties and we do the canthopexies. Tell all of my patients, for 6 weeks, you're going to look Asian. You're going to have a very slanted eye appearance. But we all know that doesn't last. And at 6 weeks, it comes down and you have a regular eye. So if you're really drastically trying to take a very round eye and make it almond shape, does that actually last and does it work? And I can only imagine that to get it to last and to work, you'd have to do something really aggressive, cutting those tendons, putting them in really awkward, non-anatomic places, right? To get it to stay and dramatically change the shape of the eye.
Yeah, I mean, that if you really want an extreme change, your canthopexy needs to be aggressive, or you have to do a canthoplasty and cut the canthus and cut that lower lid tendon, which is not a big deal. I mean, I do it. I used to do a mid-face lift through the eyelid, until I really got, and this is like back in the day. This was like in the 90s. I used to do a lower lid mid-face lift, which was a little bit harder. I mean, there were some things I liked about doing it because you didn't have to have an incision up in the hair. But now I do everything from up in the hair with an endoscope, and it's so powerful. It's so good. And, especially with the ability to use sutures and to use the endotine devices that I use, no financial interest, it really makes a huge difference and looks awesome. It changes the shape of people's faces to be much more heart-shaped and oval and but are we changing the shape of the eye is what I want to get to. Are we actually changing the shape of the eye? If you do it in an aggressive manner. Aggressive. You have to. But if you do super aggressive, now you're really going to have problems, potentially. I mean, this is not where you really got to go to someone who knows what they're doing around the eye. If they know what they're doing, you're going to be fine, because a canthoplasty is the treatment for all the lower eyelid problems that you can have, no matter how, which is why it's surprising that somebody got an ectropion after this procedure. Because by definition, a canthopexy is supposed to treat a drooping lower eyelid. So why do they now have a drooping lower eyelid after the procedure? My theory is that they put the stitch into the wrong structures. They didn't get the actual canthus to do the pexy. Right. So there's also the term a negative vector lower lid. And this is something that we talk about at our meetings a lot, and it's a term that I think that the listener should understand. Right. The concept that your eyeball sits over your orbital rim, the cheekbones of your all intents and purposes. Yeah, but there's a cheekbone, and then there's that rim of your lower orbital bones, the bones of your eye socket. If the globe, the eyeball sits out over that rim, that makes you a negative vector. And that is a tricky one to treat. Hard. That is hard. Because then when you scar in, the lid tends to pull down and pull away from the globe, and you get what's called an ectropion. Yeah. The treatment, of course, being multiple things, but typically the first line of treatment is a canthoplasty. And so when I do lower lid surgery on negative vector patients, I tend to do a canthopexy, at least, if not a full-on canthoplasty. Right. And that's where you actually do have to be aggressive 100% with it, because in the healing period, it's going to want to pull down and scar and pull away from the eye. So you really have to get that canthal tendon pulled up high, and they're going to look very Asian for a while. But you have to do that. Yeah, it needs to be overcorrected at first, and that's okay. And you just tell patients, look, it's going to be a little high, and then it's going to come down. It always does. Now, to get that almond eye, you do have to, it's an artful procedure, and it looks cool, but you got to know how to put it in the right place. And I love doing this. If you talk to a lot of plastic surgeons, they're just not like we are. They don't love this. They don't love lower lid surgery. They tend to kind of go like, like I'm just going to do a little of this, little of that. I tend to dive in with both feet and, get it going and just, do what I got to do, because I'm very comfortable with the lower lids. I did it's kind of all comes down to your training, doesn't it? It's like, what did you do in training?
With.
Well, when I was training in the University of Pittsburgh, airbags weren't invented. And so we had face fractures like they were out of style. I mean, on any given week, there are a couple, 3, 4, if not 5 severe facial crunches where a canthoplasty was kind of part of the deal because we were exposing the cheekbone, we were exposing the orbital rims, we were putting everything back together with plates and screws. And the thing that you did when you put it back together was a canthoplasty. You had to put the lid back together. And so that was just something we did all lot.
The time. Right.
Nowadays, you don't get these kind of fractures in. And so the training's different, and if you want to get canthoplasties under your belt, you kind of got to go with people that do a lot of them. And there aren't many that do.
Yeah, this is definitely something where you want to go to someone who knows what they're doing, who does a lot of them, because the complications can be very real. And the complications themselves are very challenging to fix.
Yes.
So you don't want to have a complication because the treatment can be very intense to fix that complication. So any general plastic surgeon, for the most part, that does faces knows how to do a blepharoplasty, knows how to do a brow lift, that's literally what we do. But if you're really trying to go for like an aggressive correction to your eye shape or you want to change it dramatically, I would say definitely go to someone who does it a lot because that level of escalation and treatment needs to be handled by someone that does this a lot.
For sure. And that's the thing. This term fox eye procedure is getting thrown around a lot on social media and the internet.
Sorry. Did I just barf out loud all over the mic?
Yeah, we should do, what we're going to do? We're going to do our least favorite terminology in plastic surgery. And we're just going to go down them one by one.
I have a list.
Yeah. It was funny. I was listening to Will Ferrell on the Smart List podcast, and he went on live and he brought with him, he goes, well, it's February, but I brought my New Year's resolutions anyway. And so he was reading them and it was a really long list. It was great. So we should do that with our least favorite. His favorite one my favorite one that he brought up was, he said, for the next year, I want to refer to money, all money, as cheddar or cheddar cheese. And for $100 bills, I want to refer to them as blue cheese. And I thought it was so great. I was like, it was good. And he had lots of them just like that.
Yeah. Oh,
but we should go through our least favorite plastic surgery terms because I know fox eye's on your list.
On my list. I get it. I get why it's called that. It's such a marketing terminology for a very generic procedure we all do.
Correct. I will tell you that I got a review this week on Google. And I'm very grateful for the review because it was really great. And it was from somebody who's in the medical field, and I did a revision rhinoplasty and a breast augmentation for her. And she's so happy, she's over the moon. Somehow in the review, she said, and he did a scarless breast augmentation for me. And I was just like, I never said that ever. Because I can't stand
Oh my gosh.
And I'm like,
are you going to be the scarless breast augmentation surgeon? My gosh.
Like, what is that? Like, how, there's a scar, by the way. In case you didn't notice, if you look in your inframammary fold, there's a scar. So it's like, God, the patients just want to label stuff. They want to do it. And this fox eye procedure is no different.
Yep.
This is basically,
it's a sexy label. Everyone knows
blepharoplasty
what you're talking about.
Yeah. And by the way, so somebody called in to us for the fox eye procedure, and my team, of course, who knows what this is, and they said, well, look, the fox eye procedure, that's a canthoplasty or a canthopexy, along with lower lid blepharoplasty with a mid facelift and a lateral brow lift. That's $55,000.
Yeah.
And she's like, oh, but I called this other office and it was only $8,000. And it's like, so what are people selling as the fox eye procedure then?
That is my question. That's why I do not like these terminologies and these slap a label and marketing and deceiving the patients all for some cutesy little name. It's like, you got to know what you're getting. Like, what is the actual surgery? You're going in and you're asking for a cutesy name, but like, what are you getting? Like, what is the procedure?
I don't know. I think that's the key. But this is something I do a lot of. I'm correcting this one, I think, from back east, and it's going to take like a mid facelift, and You know, they didn't do any of those things. So maybe the fox eye procedure for $8,000 is like little tiny small incision, a little stitch, and close. You know, which would take me 30 minutes to do both sides. If that's all you're doing, if you just make a tiny cut, put a stitch in the canthus and tack it to the periosteum of the orbit and close. Does that look good? I mean, it's going to look good for a couple, 3-6 weeks, maybe. Yeah. I don't know, but that's not how I would do it. I would do something where you support the surgery to look that way for a long period of time. I just, you know, you and I don't do like sort of sham procedures like that. We just don't.
Procedures.
You know, it's just not our thing. It's not. I mean, I don't want to knock anybody that does. It's, you know, they can do that. It's fine. There are patients clearly that want small, no-brainer procedures that kind of work. You know, like the threads are a great example. Like getting threads, it's like, okay, so that lasts 6 weeks. And you got a bunch of, you know, plastic through your face that is going to take, you know, 9 months to absorb now and leave a ton of scar. So I'm not a huge fan of the threads, but it's a quick procedure. You know, there are plastic surgeons doing it, and there are patients, I'm sure, that are loving it. And they're like, and they're sending their friends, and, you know, it's less than having a mid-facelift. It's less than having a facelift. So the fox eye procedure in my world is a big deal procedure that's going to look great for a very long time. If you want to get the smaller version of it, I don't really know how to do that. So you have to find somebody that does.
Find someone that does. But that's the key. That's the take home. Find someone that knows what they're doing and talk to them and ask them what you're going to have done and what the realistic results are and what are the potential complications. You know, it's a real surgery. So do your homework.
Should I put together a section on my website for the fox eye procedure?
I think you already have.
No. Do we? Do we have that now?
I think you do.
I have a section with before and afters?
Oh, I don't know about that. But I did Google this, and your name did come up.
And you didn't slap me? I thought you would slap me over that one.
I still have to do a podcast with you. You can't have like a big hand mark on your face. Raise some eyebrows. I wanted to.
I know.
I still
sure
want
you
to.
Did. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.